Lovelies, welcome back. If you are new here, welcome to the channel. If you like what you see here or this video brings you value, I would love to have you subscribe and join our tribe. There's a lot of awesome motherhood content and we're all about mothering with purpose here on this channel. Is a foster care video, and I know it's been a while since I brought you a foster care video. A big part of this channel is equipping you as foster parents or people caring for vulnerable children. It's a deep passion of mine and I just want to help you in any way that I can. So today we're going to be talking about something that I learned in my training, and it's called stage versus age and parenting the child at their stage, not their age. Many foster children will experience something called arrested psychological development, meaning the child becomes stuck at a certain development for an extended period of time. This is something that is very evident in children that have been exposed to trauma. Abuse, neglect, parental, drug and alcohol abuse, separation from the primary caregiver, whether sudden or over extended periods of time, removal into foster care, adoption, change of the child's primary caregiver can all affect the child's developmental age. So for example, if you have a 7-year-old foster child who was neglected before you started caring for her, she may come to you and she very well may not behave like a typical 7-year-old. And very often you will see even toddler or infant-like behaviors because those needs were not met at that age. As foster parents, we must lower our expectations of the child's behavior based on their age. They just don't have the understanding or the ability to function as a typical 7-year-old when they've been exposed to trauma. We have to parent them at the stage they're at and not the age. Depending on the severity of trauma, the time period the child was exposed to trauma, what the type of trauma was, these will all vary on what kind of stage that the child is stuck at. But for example, if we're seeing a child who is having a lot of typical toddler or even infant-like behaviors, we need to go back to the beginning. So doing things such as swaddling, like wrapping the child in a big blanket, holding them and rocking them, even like shushing quietly into their ear, and treating them as if they were an actual infant, spoon feeding them, making a lot of eye contact as you would with a baby when you're trying to teach them things. So we need to go back and treat that 7-year-old as an infant and help her to get through the developmental stages until she can reach her appropriate stage for her age. Once you know the child's infant needs have been met, you can then start working them at toddler needs. So sitting with them and stacking blocks, for example, or learning colors and pointing out shapes, teaching them to color in a coloring book, getting dressed, even things like this. Some children that are older may not be able to do. So once you've met the infant needs, then you go into the toddler needs and so on and so forth. And a great resource, I love Baby Center. It explains to you regular development for a typical child. I was taught that it takes twice as long to correct trauma behavior as it did to cause it. So for example, if you have a 2-year-old that was severely neglected his or her whole life, it's going to take another 4 years for them to catch up to the proper developmental age. This is how severe the effect of trauma is on a developing brain. This is why early intervention, therapy, and a loving, nurturing, supportive foster parent is so imperative to the child's growth. We must go back in order to move forward, and we have to remember to be calm and patient because it's frustrating when you have a 7-year-old behaving like a 2-year-old tantruming toddler. And it's easy to think, okay, they should know this, but you have to remember their brain was never nurtured at that stage, so they don't actually know it. So going back and treating them like they're younger versus treating them like a 7-year-old is actually going to give you huge leaps and bounds in their development. One of our foster children that came to us, this was very evident in their behavior, and we did a lot of swaddling and rocking, and that child began to look forward to that. Every day at night before bed, I would rock and rock and rock that child, and they were not an infant, but I would rock and rock and rock that child like they were, rubbing their back, keeping them tightly wrapped in a blanket. It really, really helped to calm the negative behaviors that they were having and just meet them at that need. I would gaze into their eyes, make that eye contact, and at first it was uncomfortable for the child because they hadn't ever experienced that, but then you could see that that child began to look forward to it. I noticed a huge change in their development when I parented at their stage versus their age, and then some kids are quicker than others to catch up. Again, it depends on a variety of things, the severity of trauma, the length of trauma, the type of trauma, all of that. So just keep that in mind, especially when you're feeling frustrated with a certain behavior. You have to remember stage, not age, especially when it comes to potty training, things like that. Often you will get kids much older that should be potty trained, but they're not, and they have no desire to, and actually use their bathroom habits as a way of testing your love and your support for them, because a lot of kids in foster care, they're not used to having an adult. They don't trust adults. So this is a way that they will try and test you and test your love. And you know, it does seem counterintuitive to us, but we have normal, healthy, functioning brains. These children do not. You have to remember that the trauma severely affects their development. Anyways, I just repeat this to myself sometimes when I'm dealing with things stage, not age. Even with our current placement, who we've had since birth, just the act of removal from their biological parents caused trauma, amongst other things. So remembering that, you know, like she's 19 months old and doesn't sleep through the night yet. So I, with my kids, would have done like a gentle sleep training method. With foster children, I don't believe in sleep training because their brains are just, their development is not there. It's not as it should be. So she still does need me to get up with her and hold her and give her a snuggle and give her a bottle. And I'm not rushing that process. You know, I know eventually, hopefully she's going to be sleeping through the night, but I'm not trying to rush that process with any sort of sleep training. I have to remember that she's younger than she is, even in speech and other areas of development. So it's just really helpful to remember. For me, I just repeat it to myself, stage, not age. So I hope you guys find that little tip helpful. You may have learned it in your training when you became a foster parent or extended training you've done since. I've heard it a lot in the various trainings that I've gone to over the past few years of myself being a foster parent. But stage, not age, it's huge, and you will see a lot of growth when you start parenting at this stage and not their age. So I hope you find this helpful. If you did, please give it a thumbs up. Share this video with someone you think might find it helpful. Subscribe if you're new. I would love to have you, and I'll see you guys on the next video. Bye.